Friends, urinary incontinence or urinary leakage is a common phenomenon. It happens in children, more so when they don't know how to control and mother teaches them how to control urine. It happens at night, which is called bedwetting or enuresis, where mother attempts to teach them, but beyond 6 to 15 years in that age group, if you don't treat them, then they probably land up with a bedwetting phenomena which can continue and persist even in later life. So bedwetting is treatable. Incontinence or leakage in urine is treatable for children. But what about adults? Adult women go through leakage of urine more commonly than men, and the leakage of urine can happen in many ways. So, if somebody is leaking urine, then why would she live on diapers? That's what the question is. So, are you living with incontinence or are you ready to leave incontinence? If you're ready to leave incontinence, listen to this. Women leak urine more frequently, but two ways. Number one is that as the pelvic floor undergoes a weakening as a result of age related changes, as a result of pregnancy and pregnancies, as a result of hormone loss, which happens at menopause, and the age which brings about a loss of elasticity of the pelvic floor because it's made like different from what men have. Women can leak urine as a result of coughing, sneezing, getting up from the bed, bending down for prayers or bending down for work, climbing stairs, etc. etc. And this is called stress incontinence. Stress is not mental, but the stress is physical to a pelvic floor, which is undergoing a progressive change with age. And this happens to women. When you can control this, you have achieved a lot. And this is something which probably is not known to many women. So they continue to live a life on diapers. It is almost incarceration of women in that age, mature age group, where she is wearing diapers when she travels out. She's scared about leakage of urine. And this is completely treatable, friends. Treatable and curable. So why are we living with diapers? Why are we living with leakage of urine in the stress incontinence group of women who leak urine when they cough, run, jump, laugh, bend? On the other side is a leakage of urine which happens because now the pelvic floor is not at fault, but the bladder is at fault. And the bladder's job is to contract and push urine out when you want to do it. That means you are the master and the bladder is a slave. But what happens when the bladder contracts erratically and just contracts whenever it wants to while you're not prepared? And that's where the bladder gives you a sensation that you go for urine more frequently. Sometimes you can't control this urge, an urgency, which is a sudden desire to pass urine, and you have to excuse yourself. You be in a class, you be in a bus, you be in a queue. That's urgency. If you don't excuse yourself, maybe you could leak urine, and that's called urgency incontinence. So, frequency of urination going up, urgency has a strong desire which is compelling enough that you can't postpone it, an urge incontinence or leakage of urine where somebody has to wear diapers, and it becomes a vicious phenomenon again, more common in women than men.